If you're over 60, here's something you've probably never thought twice about: the position you fall asleep in tonight. Most people assume sleep position is just about comfort, a stiff neck, a sore shoulder, maybe a bit of back pain in the morning. But there's a quieter story happening in your airway and your heart rhythm while you sleep, something most people never connect to their long-term health at all. And by the end of this video, you'll understand exactly how that connects to stroke risk and, more importantly, what's actually worth doing about it. In the next few minutes, you're going to learn what's really going on inside your body when certain sleep positions make nighttime breathing harder, why this matters more as we age, and the specific warning signs that mean it's time to talk to your doctor. Not guess, not panic, just have an informed conversation. This isn't about scaring you out of a good night's sleep, and it's not about making you afraid to roll over in bed tonight. It's about giving you the real mechanism behind a topic that gets oversimplified constantly online, so you know exactly what to watch for and what you can safely ignore. Before we go any further, a quick and important note. This channel is for education, not diagnosis. I'm not your doctor, and nothing in this video replaces a conversation with the physician who actually knows your health history, your medications, and your specific risk factors. Think of everything you're about to hear as background knowledge, the kind of thing that helps you ask sharper, more informed questions at your next appointment. It is not a replacement for that appointment, and it's never meant to make you second-guess your doctor. If anything, this should make that relationship stronger. Let's clear something up first, because the title probably made you picture something dramatic, like a stroke happening the instant you roll onto your back in the middle of the night. That's not quite how this works, and I want to give you the accurate version, because the accurate version is actually far more useful to you than a scary oversimplification. The real link isn't that sleep position directly causes a stroke. It's this. Certain sleep positions can worsen a condition called obstructive sleep apnea, and obstructive sleep apnea is a well-established, independently recognized risk factor for stroke that doctors and cardiologists take very seriously. Here's what that condition actually is, described in plain, everyday terms. During sleep, the soft tissue at the back of your throat naturally relaxes. In some people, that relaxed tissue partially blocks the airway. Your breathing becomes shallow. Sometimes it stops altogether for several seconds at a time, your blood oxygen level dips, and your body reacts with a kind of internal alarm system. A brief spike in blood pressure and heart rate designed to jolt you back into breathing normally. Here's the part that surprises most people. This can happen dozens of times in a single night, sometimes more than 100 times, without you ever fully waking up or remembering a single moment of it. You could sleep a full 8 hours and still have your body cycling through this stress response all night long, invisible to you completely. Now, here's where tonight's topic comes in directly. For many people who already have some degree of sleep apnea, though certainly not everyone, lying flat on the back makes the blockage noticeably worse. Gravity pulls the tongue and the soft tissue of the throat backward, narrowing an already vulnerable airway even further. Sleep doctors actually have a specific clinical name for this pattern. They call it positional obstructive sleep apnea, a documented condition where breathing disruptions are measurably worse when someone sleeps on their back compared to their side. This isn't a fringe theory. It's a recognized category within sleep medicine. But here's the part that most people never connect, and it happens to be the part that matters most for your heart and your brain. Picture this pattern repeating night after night for months or even years, completely unnoticed. Each time your oxygen dips and your body forces itself back into breathing, that's a small stress event on your entire cardiovascular system, a brief surge in blood pressure, a burst of stress hormones flooding your bloodstream. One night of this on its own is essentially harmless. But thousands of nights, repeated year after year, and that ongoing strain becomes associated with persistently higher blood pressure and with irregular heart rhythms, especially a specific condition called atrial fibrillation. And atrial fibrillation happens to be one of the most well-documented, most significant risk factors for stroke in all of cardiology. When your heart beats irregularly instead of in its normal steady rhythm, blood can pool inside one of the heart's chambers instead of flowing smoothly through. That pooling can allow small clots to form. And if one of those clots breaks loose and travels up to the brain, that is what causes a stroke. So let's walk through the honest, complete chain of events because this is the part that actually matters. Sleep position can worsen airway blockage in people who are already prone to it. Worsened airway blockage leads to more frequent drops in blood oxygen throughout the night. Repeated oxygen drops over time are linked to higher blood pressure and a higher risk of developing an irregular heart rhythm. And both of those outcomes are established, well documented stroke risk factors. This is not about one bad night spent lying on your back. It is a slow, cumulative pattern that builds quietly over years, almost always unnoticed, because nearly all of it happens while you are completely unconscious. That's exactly the part I want you to sit with for a moment, because it actually contains good news hidden inside it. It means the underlying problem isn't mysterious, and it isn't unfixable. But fixing it does require knowing your own warning signs, which is exactly what we're covering next. We're about halfway through this video, and here's what's still ahead. The specific warning signs your own body might already be giving you every single night. Signs that your spouse or partner may notice long before you ever do yourself. And the one simple doctor-approved step that helps far more than obsessing endlessly over which particular side you sleep on. You genuinely do not need an expensive sleep lab to start noticing patterns in your own body. Here are the signs that sleep specialists actually pay close attention to. Loud, frequent snoring, especially snoring that repeatedly stops and starts, or snoring that's punctuated by gasping or choking sounds in the middle of the night. If you sleep alone, this is one major reason so many people go years without ever finding out they have this condition. If you do have a partner, it's worth asking them honestly what they actually hear you doing at night. Waking up feeling tired despite spending a full night in bed is another key sign, not just the occasional off morning everyone has now and then, but a persistent, ongoing pattern of feeling unrefreshed no matter how early you went to sleep. Morning headaches are another clue worth paying attention to, and these can happen specifically because of those repeated overnight oxygen dips affecting blood vessels in the brain. Needing to get up and use the bathroom multiple times throughout the night is another sign. And while that might sound completely unrelated to breathing, it's actually a recognized symptom that doctors specifically associate with sleep apnea in older adults. And finally, daytime sleepiness that genuinely interferes with your normal daily activities. Dozing off while reading a book, while watching television, or worse, while driving a car. None of these signs on their own automatically means you have sleep apnea, and none of them mean a stroke is imminent. That's not the message here at all. But if you find yourself quietly nodding along to 2 or 3 of these as I describe them, it's absolutely worth bringing up directly and by name at your very next doctor's visit. You can keep it simple. Just ask your doctor, could this possibly be sleep apnea? That one direct question alone has the power to meaningfully change the entire direction of your care going forward. Now, here's where I want to save you some money and also some false hope, because there is a tremendous amount of marketing built around so-called stop snoring pillows, positional wedges, and specialty sleep gadgets. Simple side sleeping absolutely can help some people who have mild positional sleep apnea, and doctors do sometimes recommend positional therapy, meaning specific devices or gentle techniques that discourage back sleeping, as one legitimate part of an overall treatment plan. But here's what matters most. Sleep position alone is not a substitute for proper medical diagnosis and treatment if you have moderate to severe sleep apnea. That level of severity typically requires a formal evaluation through a sleep study and often benefits from treatment such as a CPAP machine, which remains genuinely effective and extensively studied in medical research. So the honest, complete takeaway here isn't that simply sleeping on your side protects you from having a stroke. The real takeaway is that if you genuinely suspect you might have sleep apnea, the right move is to get it properly evaluated, because treating the underlying condition addresses the actual mechanism at work, not just one small variable within it. Side sleeping might end up being one helpful piece of a larger puzzle for some people, but it is not the whole picture on its own, and it is certainly not a cure by itself. So let's close the loop we opened at the very beginning of this video. Does your sleep position actually affect your stroke risk? Indirectly, yes, through its meaningful effect on sleep apnea severity, blood oxygen levels, and heart rhythm over an extended period of time. But directly, causing a stroke overnight, all on its own, simply because you happen to sleep on your back? No, and honestly, anyone telling you that directly is oversimplifying a real medical topic just to grab your attention with fear. The real story here is slower to unfold, but it's also far more fixable. And honestly, it's more hopeful too, because it means there's something concrete and practical you can actually act on starting today. Here's exactly what to do with everything you've just learned. First, start paying closer attention to your own warning signs: snoring, gasping, persistent morning tiredness, morning headaches, and if you share a bed with someone, go ahead and ask them directly what they've noticed while you sleep. Second, bring this up directly with your doctor using the specific phrase sleep apnea evaluation. Doctors take this seriously, and a home sleep study today is often far simpler and more comfortable than most people expect it to be. Third, if you are diagnosed with any level of sleep apnea, be sure to follow your doctor's complete treatment plan, whether that includes positional therapy, a CPAP machine, or specific lifestyle adjustments, rather than picking just one single piece, like simply changing your sleep position and assuming that alone will be enough to protect you. And finally, always talk to your doctor before changing any medication or before starting anything new, even something that sounds as completely harmless as a new pillow or a positional sleep device, because some of these products can interact with other health conditions in ways that are genuinely worth checking on first. You've made it through the accurate, complete version of a topic that a lot of channels online tend to oversimplify for the sake of a dramatic title. And honestly, that says a lot about how seriously you take your own health and your own long-term well-being. If this video helped connect some important dots for you today, go ahead and hit subscribe so you don't miss the next one, where we're breaking down the early warning signs of irregular heart rhythm that most people completely miss until it's much harder to ignore. Take good care of yourself, and I'll see you in the next video.